Hey, future medics, Tina here, your medic mentor. And today we're going to continue our drug card series and we're going to go over an EMS heavy hitter. It's epinephrine 1 to 1000. This one's going to be used for anaphylaxis and severe respiratory distress. So it's one we're going to want to get really familiar with really quickly. Okay, so let's break this one down. The name, epinephrine. One word, like share. Brand and generic makes it so much easier. There are two that you're going to need to know. This one is epinephrine 1 to 1000. That's the concentration of it. This one's really important to know. 1 to 1000 is the epi that we're talking about today. It's often called epi 1 to 1. 1 to 1000 means there's 1 milligram in 1 milliliter. So that tiny little milliliter has 1 entire milligram in it. That's a heavy concentration, and it's a heavy dose, which is important to know. This does not go IV. You cannot do this one IV. It's done IM or sub-Q, that's it, because it's very concentrated. Epinephrine is a sympathomimetic, so it stimulates alpha and beta receptors in the body. For alpha receptors, you're going to see vasoconstriction. So those vessels are going to get really tight to increase the blood pressure and get blood moving around in the body. Now, beta 1 is going to increase your heart rate. One heart, beta 1, it's going to increase your heart rate and it's going to increase that contractility, that really big push and contraction of the heart. And then beta 2, which we've talked about, which I know that you know, it's going to open up those bronchioles so that you can breathe. You're going to give this for anaphylaxis or for severe respiratory distress. So remember whenever we talked about albuterol and Xopenex and all of that and how the receptors are inside of the lungs? Well, if you're entirely clamped down because you're in severe respiratory distress or you've got swelling in the airway from anaphylaxis, nothing can get through to get to those receptors in the lungs. So you're going to give a dose of epinephrine, obviously follow your protocols, but you'll give a dose of epinephrine to open up the bronchioles so the medications can get down into those alveoli and actually get to the receptors to work. Because if the medicine can't get there, it can't work. Think of it kind of like opening up lanes on the highway after a car wreck so traffic can flow. That's what the dose, super easy. 0.3. 0.3, right? Not 3, it's 0.3, okay? So not even a full milliliter, not even half a milliliter, very small dose, because like we talked about, it's very concentrated. And we're to give this one IM, and we often teach people that it goes in the lateral thigh. That's because we're teaching people to use EpiPens on themselves, and it's easier for them to just reach down and hit their thigh with their pen. But this can go intramuscularly, so it can go anywhere there's a fair amount of muscle. So if someone's wearing short sleeves and you can pull their sleeve up and get to their deltoid really easily and they've got a fair amount of muscle there, use it. It's not a problem. It will work just as well. And whenever you give this, it starts working almost immediately. Because of the alpha effects, we're going to see some tachycardia, maybe some tremors or palpitations from this one. So obviously we're only going to use it if we need it. But if your patient can't breathe or they're crashing, getting them to breathe is kind of more important. This wears off pretty quickly, so just monitor their heart rate, keep a really close eye on them, and 3 to 5 minutes, those effects should go away. Okay, so here's your takeaway. Epi 1 to 1 is your go-to for anaphylaxis. Absolutely. It buys you time by opening up those airways so that they can breathe, and that way you have a little bit of time to fix the underlying issues. That's it. That's another one done. You're doing such a great job. I'll see you for the next one.